Hello, let's today in this video we discuss about the dengue fever. What is this dengue fever? Types of the dengue fever, causes for this dengue, some of the signs and symptoms you will observe while you are behaving with the dengue fever, diagnosis, treatment, and how to prevent. How can you prevent this dengue? These all basic things we will cover in this video. So video is a very important video, and by listening this video you will not go to watch other video. Means there is no necessary to watch the other videos on behalf of the dengue. Basic and every important information we are going to cover here. Let's discuss first what is this dengue. See, dengue, it is a viral infection. This is a very important one. Dengue, it's not a bacterial or parasitic infection. It is the viral infection caused by the dengue virus DENV. DENV, dengue virus. It is transmitted to the humans through the bite of the infected mosquitoes. This dengue virus, it is only transferred from the mosquitoes to the human. Okay, and it is not transported from human to human. Understand this one, only transmitted from mosquitoes to human. If the virus already generated in the human body, then if mosquito comes and bite to the human body, then what happens? The virus present in the human body sucked by the mosquito. That virus sucked mosquito, what it will do? It goes and inject to the, or it goes and bite to the another uninfected human. That virus get transported into that uninfected human and it leads to the dengue. Simple. For that reason, these dengue viruses, these mosquitoes are the carriers for the dengue virus. There are basically 4 types of the dengue virus we observed. Dengue type 1, DENV type 2, DENV3, DENV4. These are the 4 major species of the dengue virus. And dengue, it is not a simple virus. Basically, if we treat in a logical way, then definitely it is a simple virus. If you neglect this dengue, means really it leads to the severe danger, and also sometimes it leads to death. Causes of this dengue virus. See, dengue, it is a viral infection. I have told you, it is caused by the dengue virus transmitted to humans through the bite of the infected mosquito. Basically, the cause for this dengue is a female mosquito, that is Aedes aegypti. Female mosquito is the major cause here. And I have told you, you can't get dengue fever from being around an infected person. Instead, dengue fever is spread through the mosquito bites only. Okay, we have discussed this one. And one more important point to remember, dengue, see, dengue, I am telling, dengue among 20 members, if 20 members are infected by this dengue virus, means in that one will be in a serious condition. Okay, that is 1:20. Next, signs and symptoms. Many people experience no signs or symptoms of a dengue infection. There are no signs, no symptoms for this virus initially, but after if the immunity fails to defend this dengue virus, means then some may experience this headache, muscle or bone or joint pain, nausea, vomiting, then pain behind the eyes. Okay, eyeball pain, what you are calling, behind the eyes pain, and these are rashes. And the temperature 104 degrees Celsius, greater than 104, or 39 degrees Celsius temperature, heavy temperature. It is also one of the major sign and symptom of the dengue virus. Okay, in spite of this, if you are having any different symptoms like heavy bleeding, okay, faintingness, fatigue, then immediately you have to admit to the hospital. Later we will discuss what treatments you can follow in the dengue virus. Diagnosis, see, very important diagnosis are there here. By medical or travel history or blood test, we are diagnosing the test. We are asking the patient, if you have traveled to the dengue prone areas where the dengue is very largely spread, like in tropical or subtropical areas, or in very huge population where there is sewage systems, garbage systems, did you travel there? These all basic things the doctors will ask, and by this way they will do some of the blood test to identify which type of virus is present. That is very important. If virus, different 4 species of viruses are there, virus 1, that is dengue virus 1 type, it is not so severe or so critical virus, we can treat it, but remaining 3 are there, no, they might cause some of the major viral problems for the human body. Then RT-PCR test or NS1 test are done, and IgM test also done. These are the IgM, it is antibodies test, we can be done for the patient after 4 days of the virus infection, okay, or 4 to 5 days of the virus infection, then we can do this. How can we know the virus get infected? Means the major symptom here is the fever, okay. After 4 days you will suffering from the high fever. At that time, if you test, means you will get some of the IgM test reports, antibodies tests. If more antibodies react to that antigen means that virus, means that you are suffering from the dengue. Then coagulation test also preferred. Treatment, see basic what happen, there is no treatment, specific treatment to treat this dengue, there is no specific treatment, but you can treat on the basis of the signs and symptoms. Basic treatment is you have to give acetaminophen, that is a paracetamol, 3 or 4 times a day, 4 times a day or 3 times a day, okay, depending on your body weight. Then drink plenty of water also, and also drink pre and probiotic sachets. You have to plenty of pro and prebiotic daily, 2 sachets, morning 1 and night. You have to drink this with a glass of water, and drink ORS, okay, drink ORS. ORSL solution is there, no, it contains various type of electrolytes, so that it can maintain the electrolytes, and you can, basic thing, you have to maintain your body hydrated, never go for dehydrated, really it leads to hectic problem. You have to go for hydration. Then get rest, take rest is very important here, and don't take aspirin or ibuprofen like NSAIDs or any other type of the non-steroidal anti-inflammatory drugs, because they may cause the bleeding, because due to the infection of the dengue virus, the signs and symptom, dengue is also one among them. If you take this aspirin or ibuprofen, they will increase in the bleeding, aspirin and ibuprofen. Then if symptoms worst, contact emergency immediately. If you are feeling some of the means continuous vomiting, if you are feeling, or if you are feeling continuous bleeding from the urine or from the fecal matter, then contact to the emergency or admit to the hospital. There they will treat with some of the IV fluids, intravenous fluids, and if necessary, they will give some of the beta-lactam antibiotics. Basically antibiotics are not preferred here, but if the viral infection is get converted, or if the viral infection is combined with a bacterial infection, then some doctors will prescribe, or they will treat with some of the cyclosporins antibiotics also. But main important is fluid maintain. You have to maintain the fluid inside the body. That is one of the major role here in the treatment. Then prevention is very important. Avoid mosquitoes bite. Basically the mosquitoes are very active after 2 hours of the sunrise and before 2 hours of the sunset. At this time the mosquitoes are very active. These are very dangerous mosquitoes, so prevent this type of the mosquitoes by using some of the mosquito repellents or home nets available, no, by providing that mosquito nets, you can be prevented by the mosquito bite. And be vaccinated first before going to dengue prone areas. If you are willing, or if you are planning to go the foreign countries or other countries where there is a, first study the area, if that area is a dengue prone area or not. If it is dengue prone area, means first go and vaccinate, so that your body can show good immunity for the virus. Then be confident always, keep your immunity perfect, take vitamin C tablets, or by taking oranges or any citric types of the fruits, they may improve your vitamins immunity. And eat food fully cooked and boiled, this is very important. Then use lukewarm water to drink during out of station. If you are gone for out of station, means always take any the water which is totally free from the contamination. Better you can take the water from home only, by lukewarm water is best for that that you have to maintain here. Yes, this is the prevention techniques to prevent from the dengue. Treatment we discussed, diagnosis test, signs and symptoms, causes, and what is this dengue and the types. Yes, if you like this video, then subscribe our channel Legend Pharmacy, turn on the bell icon for the further drug information, further treatment for the specific disease you can get in this video, and the information is very authenticate information, very clear and cut information I will going to provide you. Thank you.